What's going on, guys? Polynucleotides, which are fish sperm, salmon fish sperm injected into your face for rejuvenation. Is this a gimmick or is this a real thing? Is this going to stay? What's the difference between polynucleotides, exosomes, other biostimulators? Are they right for you? Well, today we're doing an Instagram Live with one of my buddies here. It's Dr. Stephen Land from Newcastle, UK. He works from Novelist and he's had 20 years of experience in medicine. He's transitioned into medical aesthetics full-time, and he is highly involved with polynucleotides. He's on the faculty of derma-focused polynucleotides, and he's basically doing international speeches now for multiple companies, and he's highly regarded in medical aesthetics. I can't wait to introduce him, and we're going to be talking about polynucleotides for you guys to answer all your questions. So let me bring him in. There he is. How's it going?
That was an incredibly gracious introduction. I barely even recognized myself.
Man, we're just starting. So you actually ended up getting the, highly commended aesthetic doctor award in 2018, right?
Yeah. So
congratulations. Buddy.
Yeah, I've been doing this for about 11 years now and picked up a couple of kind of awards and commendations and stuff along the way. It still always kind of surprises me when that happens. You're like, I just rock up to work and stick needles in people's faces. I'm not entirely sure how we kind of pretend we win awards and things, but it's nice to be recognized.
How did you get into polynucleotides?
It was actually one of the other injectors that works in my clinic went on a training course about 2 and a bit years ago. So I kind of sent her away and she kind of went away and did some digging and came back and with all these kind of studies looking at kind of what it did and how it worked and all that sort of stuff. And I kind of read through the studies and went, yeah, actually this sounds really interesting. And then before we'd even had a chance to kind of train, the guys from Derma Focus, who are the UK importers for a lot of the polynucleotide companies, also got in touch and said, we've got this new product that we're importing. We think you'd be interested in it. We're also putting together kind of a teaching and training faculty, and we like the way you do kind of teaching and training. So if you're interested and you like the product and you think it's good and worthwhile, do you want to think about kind of joining us on the faculty as well? So the two things kind of happened at the same time. So we started using it in clinic and the results just kind of blew us away. So we've continued using lots and lots and lots and lots of it. And then, as you say, started kind of teaching and training for Derma Focus, and then that led to opportunities speaking for Mastelli, who are one of the big companies that make polynucleotides in places like AMWC and Monaco and things like that, which has been quite fun.
If anybody's been following Dr. Stephen Land, you've probably known that he actually had a personal experience happen to himself recently, where he had to test it on himself, really, because he ended up having kind of a traumatic response. I kind of think that actually went like wildfire throughout the internet. People were posting about it, and it was really cool that you posted your journey, because so if you're not sure what happened, you ended up getting jumped, mugged, whatever you want to say, and in the end he ended up getting some pretty bad stitches and gashes on his nose, and the downtime looked pretty significant, and you just went to town on polynucleotides. And tell me how that worked out for you.
Yeah, that worked really well. As you say, so this was November last year. I was out in London after a slightly boozy business meeting. As you say, got jumped by some guy who mugged me and stole my watch. In the kind of ensuing scramble, I kind of went face first into the curb and kind of bust my nose open. So I ended up with 28 stitches altogether. So kind of a big load of stitches kind of right across the nose, some in the side, some kind of all across the top lip, some inside my bottom lip where that had kind of almost been wrenched off. So it was a bit of a mess. So 28 stitches later, it was looking, I looked even less handsome than usual. So I kind of thought it'd be quite interesting. Obviously, you and I know lots of people in the industry who have an interest in skin and wounds and healing and all that sort of stuff. So I thought it'd be kind of quite fun just to kind of see what suggestions people had for what I should do. And I'd been using polynucleotides for about 7 or 8 months by then. So I'd already kind of pretty much decided it was definitely getting some polynucleotides in and around the wounds to help with the healing. But I thought it might be quite interesting to kind of post the journey, as you say, on social media. Like Instagram, in its usual infinite wisdom, did take about half the post down for being too gory, but if you scroll back through my feed you can still find a couple of them. I've just pulled up the picture. I don't know how well it'll kind of go from iPad screen onto teeny tiny little screen, but that's kind of what my nose is. That's kind of what it looks like immediately afterwards. So there's, as I say, 28 stitches kind of in there holding it all back together, and I think I'm going to zoom in on the screen and
you look good.
My nose, but it's looking pretty good. So there's still a little bit of a scar across there, but we're only kind of 7 or 8 months, so we're still kind of fairly early doors. We're still kind of quite early on.
So what the heck are polynucleotides? What's different about that versus stem cells versus exosomes, any other biostimulator? Why do you think polynucleotides are something that we should be taking seriously?
Yeah, they're a really interesting product. Like, there's all sorts of weird and wonderful stories going around kind of on social media about what they are and where they come from and things like that. So probably starting with where they come from and what they do is a good place to start. So as you've alluded to, they come from fish sperm, which is a bit weird. Like the brand that I use, they use trout sperm, and essentially what we're dealing with, what polynucleotides are small fragments of DNA, and when they're injected, they induce your skin to do lots of different things. If we're 100% honest about it, it probably doesn't really matter where the fragments of DNA come from. The very original polynucleotide products used human placental stem cells, but they're quite tricky to get hold of. So the guys that were kind of investigating polynucleotides at the start were looking for a kind of readily available, fresh source of DNA. Sperm seems like quite a good place to get that from. The thought of using human sperm with all the kind of Human Tissues Act things that we have in Europe, and you guys have similar over in kind of North America, meant that using human sperm kind of seemed a little bit distasteful and very difficult from a regulatory point of view. So fish are quite easy to grow. They grow very quickly. They produce lots of sperm. And the reason they kind of choose sperm rather than, skin cell DNA or something like that is, our cells undergo lots of damage and pick up lots of extraneous rubbish within the cells as we age. So if you want a nice pure product to inject into your patients, you're much better starting with a nice pure DNA sample. And sperm is very freshly made. There's not really a lot in there apart from, some DNA and a few mitochondria to power them along. So you're starting with an already kind of fresh, very pure product, which makes purifying it much easier. So everyone's like, oh yes, this weird kind of salmon sperm facial. It doesn't really matter where it comes from. And by the time it's been purified so much and put kind of in the box and in the syringe for us to inject, it's just fragments of DNA that could come from anywhere, really. The company I work with predominantly use fish that are kind of fit for human consumption. So they're all very well looked after. They're very healthy. They're grown from egg up to fish. They're fed, they're looked after. I've seen the facility in Italy where they're grown. It all looks very lovely. The fish are all looked after. They get read bedtime stories and tucked into bed. And then they steal their sperm and sell them for food. So the fish kind of don't go to waste. They do get used for kind of food as well. But that's why they use kind of fish sperm. As to how it works, as I say, it's kind of fragments of DNA, so it doesn't really matter where you get them from, but once you kind of break them down into the little fragments that we use and inject them into the layers of the skin, they get broken down even further into the mononucleotides, the kind of individual building blocks of DNA, and they attach to the fibroblasts, which I'm sure everyone will remember back to their kind of undergraduate biology lessons. The fibroblasts are the ones that produce all your collagen, all your elastin, and all the other kind of good stuff that makes skin nice. And when they attach to those fibroblasts, they basically just make them work harder. So they make them produce more collagen, more elastin, more HA, which is exactly what we want. But because we're providing a kind of big pool of the building blocks of DNA, if your fibroblasts are kind of damaged and injured, which happens as we get older, a lot of that will be kind of DNA damage. So we've just given your body a whole load of building blocks to help repair the DNA. So the studies show that not only do your fibroblasts work better when you've had some polynucleotides, but actually each individual fibroblast is healthier, and then they actually start to reproduce and you end up with more fibroblasts. So you get more fibroblasts that are working harder. So overall, it's a great treatment for skin.
For anyone who's out there who's not in medical aesthetics, so the fibroblasts are the cells responsible that basically make our collagen elastin. We're always talking about, elastin degradation, collagen degradation. Sometimes, we obviously take hyaluronic acid injectables or topicals, but they all start from somewhere. They all start from something that's making it, and it's the fibroblasts. So whenever we go to these medical aesthetics conferences, it's usually a big focus on fibroblasts. And it's because the fibroblasts are responsible for making all of this stuff. And you can kind of, do whatever you can to stimulate and irritate your skin to help make collagen by almost like the scar tissue formation where you're getting a little bit more type 1 collagen that's being made. But really, this is different. Instead of irritating the skin in order to get a response that causes some collagen formation, we are now just going directly to the source that makes the collagen and elastin and the hyaluronic acid, which is the fibroblast. And if those are dying out or if they're not working properly because of age, then this salmon sperm DNA is actually being injected directly to stimulate this fibroblast in order to kind of like rejuvenate it, right? Or kind of make it more youthful.
Yeah, I mean, that's what I tell my patients. I say, look, we're going to make your skin start acting like younger skin. So, when you're 21, you've got loads and loads of fibroblasts and they're all sitting there churning out loads of collagen, loads of elastin. This is why 21-year-olds all have lovely skin. And when you get to my sort of age, like about 30% of of your fibroblasts have kind of stopped working anywhere near as well. A lot of them have become senescent and just given up altogether. We can repair them and reactivate them and get them actually working like your skin did. We're probably not going to get it like 21-year-old skin again, let's be honest. We're not going to kind of suddenly make everyone have baby soft skin. But the younger we can get your skin behaving, the better it's going to be. So, a lot of patients will see a really nice result. They'll see kind of firmer skin, fine lines will disappear, pigmentation cells, all sorts of other nice things. And some just kind of like, my skin just feels a bit better. So it's one of those kind of skin treatments where you don't necessarily kind of see a massive change in some patients, but we know that your skin is acting healthier and behaving better. It's kind of like the kind of banking collagen thing that we talk about with microneedling, where you might not necessarily see your skin massively better, but we know that in 10 years time, if you keep up with it, your skin will be exactly the same as it was when you started. So it's about maintenance as well as kind of repairing some of the kind of fine lines and things.
A lot of people expect results something like Botox, right? Because Botox
Yeah.
is so visible because they're taking care of the lines. But the other thing too with it is a lot of people, even with Botox, when you do it, you kind of feel like, wow, my skin feels better. What's going on here? There's something happening with, the relaxation of the pores, regulation of the sebum production, but you can't post those things on social media. People can't see it. And it's something that you have to kind of experience. And that's likely what I'm hearing with the polynucleotides, where your skin just ends up becoming more robust, more firm, just like Bouncier, has more hyaluronic acid.
I mean, don't get me wrong. We are seeing lots of people getting really, really nice and really kind of good, obvious kind of results that they're really happy with. But, it's one of those treatments, like a lot of the skin boosters, you just have to say, look, you just have to trust the process. Keep up with this, keep up with your skincare regime. No one starts wearing SPF and then suddenly looks 10 years younger, if they start wearing SPF. But we know we should all be wearing SPF, and we know if we keep wearing it and keep using it, our skin will continue to be as healthy as possible. So it's sometimes about doing the maintenance things to kind of keep things perfect.
Okay. So there are different types of polynucleotides. I feel like we have one type here in Canada, and I think it's only you're able to place it topically and microneedle it in. I think it's combined with hyaluronic acid and a couple other things. But in UK and other areas of the world where they have polynucleotides and different variations, it seems like you have some that are designed for injuries, some are designed for the under eyes, some are designed for the entire face, some are designed for like injection into the joints. What are the differences? Why don't they just take I don't know, something that's super concentrated and just use it for everything?
It comes down to tailoring it to kind of the specific use that you want, and to a certain degree kind of dealing with the side effects as well. So polynucleotides that we use in aesthetic medicine actually started out and everyone's kind of like, what's this new treatment that's kind of suddenly sprung onto the market? Polynucleotides have been being used since the 1980s in wound healing and wound management. The company that kind of originally came up with them is the company that I'm still mainly kind of work with. Their original product was called PDRNs, which are polydeoxyribonucleotides, so slightly longer name, but a very similar product. And they're very short chain, have a really, really kind of fast onset of action, a really kind of big burst of kind of action, which is very helpful if you're trying to heal wounds. What they did with the aesthetic products, the polynucleotides, that they basically made longer chains. So they hang around in the skin for longer and they have a more kind of slow and gradual effect, which is kind of what we want in the skin. We're not trying to repair a bashed up nose frequently. We're just trying to improve your skin. So if we get something that hangs around for much longer and stays there doing its job for a little while, then, that's a more useful product for us as kind of aesthetic doctors and nurses. So that's why there's kind of a little change. And then, as you say, there are products that are specifically designed for different parts of the face. And again, some of that kind of comes down to mitigating some of the side effects. Now, there's not really an awful lot of side effects with polynucleotides. It's one of the nice things I like about it. There's precious few contraindications and there's precious few kind of problems with it. The only problems you do tend to get are a little bit of swelling and it's a bit stingy. And that's a kind of concentration dependent thing. So the higher the concentration, the better the result, but the more swelling you get and the more stingy it is. So what the guys at Mastelli did, they kind of thought, okay, what areas of the face are we going to be treating? We're going to be treating kind of lower face and foreheads you can treat necks. And a lot of people are kind of treating around eyes. And they're like, okay, which of those areas is quite prone to swelling around your eyes? We know that area swells up a lot if we do treatments there. And so they went, why don't we make a lower concentration product for around the eye? So that kind of mitigates some of that swelling. And then they make a higher concentration product you can use in areas that don't swell so much. So kind of lower face and neck and hands and anywhere else you want to put it, really. It has to be said, the swelling is not a massive issue and not everybody gets it. So certainly with some of our patients, we will use the eye product with their first treatment. And if they come back for their second treatment 3-4 weeks later and kind of say, yeah, I didn't have any swelling, it was completely fine, I'm happy to go for it, we'll use the higher concentration product because we know that the more polynucleotides you get in there, the better.
So what I'm hearing is if you want better results, go for the swelling, but you're going to have the side effect of the swelling.
One of the trainers that worked for Dermafocus may as well have had the motto of go big or go home. And he would basically just, he's a really nice guy, a lovely guy from Liverpool with a very strong Scouse accent. And he basically just says, look, you're just going to have to put up with the swelling. If you want the results, I'm using the highest concentration product. And some of the results he's getting are fantastic because, he just says to his patients, this is just the way it is. If you want the results, you have to accept the downtime.
Yeah, and considering that the skin around the eye, it's like 0.5 millimeter thick, and it's, the thinnest skin on the entire body, and at the same time, that's the first place where we age. I think most people are probably using it for around the eyes the most, because I think you're probably going to see the most improvement where the skin is super thin, and you're going to see all the aging kind of like almost reverse a little bit quicker. How often are you supposed to use this stuff?
So our treatment protocol, and if you look at the studies, the kind of treatment protocols are usually 3 or 4 treatments about 3 or 4 weeks apart as your kind of initial course. And then we're doing 1 treatment every 6 months or so just to kind of keep up with it. There's nothing to stop you having it more often than that if you want, and you've got deep pockets and you fancy it. But the studies have showed longevity out to about 6 months. So we kind of say, 3 treatments to start off with and then 1 every 6 months. I think the official protocols say one treatment every 3 weeks. We kind of push ours to 1 every 4 weeks because that makes it once every payday, which just makes it a bit nicer for the patients because we're nice like that. But, one treatment every 3 or 4 weeks is the recommended.
And how long is the downtime? Like, what's the swelling expected duration?
Well, the injection technique, we're using a lot of kind of microboluses. So the idea being we want to get it into the dermis. That's where all your fibroblasts live. So that seems the most logical place to put the product that's going to work on your fibroblasts. So what we tend to do around the eye is lots and lots of little microboluses, as close to being in the dermis as we think we can get with the tip of a needle. I'm not going to claim to be a good enough injector to get the tip of my needle directly into the dermis, around the eye, every single time, into an area of skin that, as you've said, is 0.5 millimeter thick. I don't think I'm that good, but the idea is to get it as close as possible. So you get lots and lots of tiny little blebs kind of along the eye initially, and then over time they kind of settle. And for most people, the little blebs settle by the end of the day, usually within 24 hours, but you can get a little bit of residual swelling for 24, 48 hours usually. The odd person, it goes on for a few days, but most people it's kind of 24, 48 hours.
Cool. Okay, so for you, that versus exosomes, or you guys also have, it's an injectable Profo. Yeah.
So, we have all sorts of weird stuff over here that you guys don't get because that's just fun. I think it's mostly because you actually have a regulator that seems to actually take things seriously. So you have to do lots of studies to kind of make sure that they're okay. And I think a lot of companies kind of use Europe as a bit of a kind of test bed to see whether products are okay. Let's say this product's been around for kind of 40 years and no one's grown gills yet and no one's kind of grown fins. So I'm fairly happy it's okay. But compared to the other things that we're using. So exosomes, I'm still a little bit on the fence about. We're trying them in clinic to kind of see what results we get, but they are brand new. And I think, the theory sounds really good with exosomes. And for those that don't know, exosomes are essentially kind of little kind of extracellular vesicles, little bits of cell membrane with all sorts of growth factors and interesting things inside them that we can microneedle into the skin. The idea being that those growth factors then get passed into your skin. So exosomes are very new, and as I say, we're trying them. But the thing with exosomes is that you have to be a little bit careful on kind of what the source is and where they're coming from and the processes by which you gain your exosomes, because exosomes are little packages of messages that transfer between cells. So if you've got a group of bad, nasty, knackered old cells and you collect their exosomes, you're going to collect bad, knackered exosomes. If you've got healthy, lovely, fluffy cells that are all very happy and working well, you're going to collect, happy exosomes. So you need to make sure that's much more kind of variability. So you need to be very careful on your source of your exosomes and where they're coming from and what the cell type is and all sorts of things like that. So we're still in the very early days of exosomes. I think they have a lot of potential, but I think we're still kind of testing them at the moment.
Well, compare that to, let's say, polynucleotides. Is there something similar? Do we have to be aware of where you're getting them? Is there bad batches?
Well, I mean, in Europe, there are only 2 manufacturers of exosomes in Europe. There's lots of different brands because some of the brands kind of make the exosomes and then sell the kind of raw exosomes off to other manufacturers that then kind of rebox them. But there are only kind of 2 manufacturers of polynucleotides in Europe. So pretty much any of the European ones will be fine because they come out the same two factories in Italy. So I work with Mastelli, whose in-house brand is called Plynest. They were the guys that pretty much invented polynucleotides, and working directly with them gives me access to all the kind of new research as soon as it comes out, and any new products they come up with along the lines of polynucleotides. So that's why I kind of like working with them. And one of the, I have to be really careful here so I don't get told off by various people, but one of the factories in Europe recently lost its CE mark. So it doesn't have a CE mark to be used as an injectable at the moment. It did have one, and then they went through a rebrand, and I think someone forgot to fill in some paperwork somewhere and they lost their CE mark. So at the moment, it's not CE mark to be used as an injectable. It's probably completely fine because the product itself hasn't changed, but you just need to be, I think you just need to be a little bit careful when you're injecting things into patients, that everything you're doing is as above board as possible.
If anyone has a fish allergy, can they use it?
This is a question that gets asked kind of quite regularly. People ask about seafood allergies. Seafood allergies are completely fine because kind of most people who are allergic to seafood, it's usually kind of crustaceans and things like that. And the actual protein, the antigen that they're allergic to, is something that's only found in kind of shellfish and crustaceans. So shellfish allergy, absolutely not an issue. True fish allergy is pretty rare, and people who are allergic to fish are usually allergic to one specific species of fish. So as long as it's not trout in the case of the brand that I use, or salmon in the case of the other kind of big European brand, then you're probably fine. I would probably do a little patch test somewhere to be on the safe side because I'm a bit cautious like that. But I think on the whole, you're going to be okay. As I say, there's not really much in the way of contraindications. So.
Okay, cool. And then when should people start expecting visual changes where they'll see differences, benefits?
We always tell our patients that they need to complete the full course of 3 treatments, and they'll probably start to see some results kind of a month or so after that. So again, it's that kind of setting patients' expectations. If you tell them they're going to look totally amazing in 2 weeks' time and they don't, they get all annoyed about it, and rightly so. So we always kind of say to people, look, you do need to complete the full course. You will start, this is a skin treatment. We need to wait for your skin cycle to kind of, fully kind of go through its cycle before you'll kind of start to see results. However, we are seeing people come back for their second treatment. So kind of 3-4 weeks later, they're coming back for their second treatment going, oh my God, the skin under here looks better and brighter already. So I wouldn't guarantee that people will look better by the time of their second treatment, but we're certainly seeing it in a significant number of our patients are kind of coming back very happy after the first treatment, which makes it quite an easy sell to get more treatments for them. So it's quite nice.
Can you pair polynucleotides with other biostimulators? Do they contraindicate each other? Is there anything that you wouldn't do at the same time? Could you do a microneedling radiofrequency device right over it, or is that going to deactivate it? Do you have any idea about that?
We've kind of come up with this concept that we're calling skin priming, which is using polynucleotides in conjunction with other treatments. If you think about the treatments that you just mentioned, things like microneedling, radiofrequency microneedling, infrared, all the other things, all the energy-based devices that we frazzle skin with or poke holes in skin with, what you're doing with those is causing a controlled injury to the skin and then waiting for it to heal. And the healing aspect is the fibroblasts. So if we do 2 or 3 polynucleotide treatments first, get your fibroblasts as healthy as possible, get the greatest number of fibroblasts that we can possibly get, then we hit it with a treatment that stimulates them to work harder, you've got more of them to work harder. So we're seeing some really nice results by doing our 2 or 3 treatments of polynucleotides, and then so kind of polynucleotides, 3 weeks later polynucleotides, 3 weeks later polynucleotides, 3 weeks later hit them with your energy-based device of choice, microneedling, RF, Morpheus 8, Exion, whatever it is you use in your clinic. And because you're then stimulating some newer, fresher, healthier fibroblasts, you get a better result with it.
Especially if you're doing a resurfacing with lasers or any downtime, you're probably going to heal much quicker.
And you can actually combine it with exosomes as well. There's no harm in that. We know that a lot of the things we're seeing with exosomes is things like improved wound healing, decreased kind of downtime from procedures. So throw some exosomes in there as well. If patients have got the kind of cash for all this, then combining polynucleotides with exosomes with energy-based devices, you're going to get some fantastic results. A good friend and colleague of mine is combining polynucleotides and exosomes and microneedling for hair loss, and is getting some phenomenal results. So yeah, she's getting some really, really good results using a combination of everything that she can throw at the hair follicle to stimulate it, make it healthier, and get it producing thicker and better hair.
Have you tried partnering it with Profilo?
Yeah, so Profilo is another product you guys don't have in North America yet. Sorry, another one we've kind of started. It's another Italian product as well. I don't know what it is about the Italians and inventing kind of crazy products. The Italians come up with all these kind of cool injectables. So if you speak to Italians, all Italian women look absolutely gorgeous and beautiful and have stunning skin, and they'll tell you it's all their Mediterranean diet and they eat lots of tomatoes and olive oil. It's not. It's because they've been injecting fish jizz into their face for the last kind of 10 years. And using Profilo. That's my theory anyway. So Profilo, for those that don't know about Profilo, is a they don't like to describe it as a skin booster. They describe it as a kind of bioremodeler as well. It's hyaluronic acid based. It's not kind of chemically cross-linked HA. They basically pasteurize it and heat it up to form covalent bonds between the HA molecules. And when it kind of slowly breaks down in the skin over the first kind of 2 or 3 weeks that it's in there's some really low molecular weight HA and some high molecular weight HA. So you get hydration from the high molecular weight HA. And the low molecular weight HA seems to, again, attach to your fibroblasts and cause a little bit of stimulation of fibroblast activity. So with the Profilo, you kind of get this kind of dual thing. You get lots of hydration because of all the HA that you've just put in there, and you get a little bit of biostimulation. In my patients that I've worked with, we get more biostimulation from the polynucleotides. So I always kind of think, Profilo is kind of lots of hydration, a little bit of biostimulation, and polynucleotides are lots of biostimulation, not really very much hydration at all. So again, they work quite nicely in conjunction with each other, depending on what you're treating for your patient. I always think, make a diagnosis. What are we treating? Have they got dehydrated skin, or have they got crap skin quality, or have they maybe got both? In which case, use the appropriate product, or swap and change them around. So certainly with some of our patients will do, once they've had their initial course and they go on to their kind of maintenance, we might alternate. So we might do polynucleotides 1 month, and then 3 months later we'll do some Profilo, and then 3 months later we'll do some polynucleotides, and 3 months later we'll do some Profilo. So there's no harm in kind of swapping and changing. And we're finding that because we're increasing that extracellular matrix and improving the collagen and elastin with the polynucleotides, we're actually getting better and longer lasting results from the Profilo because the HA hangs around longer. It's got more extracellular matrix to kind of hold it in place. So when that gets injected, it hangs around for longer. So it's a nice combination treatment with pretty much anything else you care to throw at it.
Cool, man, that is great. I think we covered everything. I want to I'm reviewing some of the comments. I think that we covered everything. Someone's asking, do you massage it afterwards after you place it into the eye or anywhere?
You can do. I always tell patients, the little blebs generally disappear by the end of the day. If they're really, really bothering them, give your hands a really good clean or put on a pair of gloves, and you can give them a little massage and massage them out. There is a study coming out in about a couple of months' time done by, Ting Song Lim. He's been using polynucleotides for ages, and he's just finished doing a split-face study. We always thought that needle was probably the best way to inject it because it gets it into the dermis, but you can use a cannula and go kind of subdermal with it. But the theory always was that it's not quite in the layer where you want it, so it probably takes a bit longer to work. But it's obviously much more pleasant for the patients because there's not 101 little blobs around their eye. So he did a split face study that should be published in the next kind of couple of months, where he did kind of needle on one half and cannula on the other half, and then looked at everyone's faces several months later, and the answer seems to be that it makes no difference at all. So we in clinic have certainly started doing a lot more of ours with a cannula, which means there's less swelling and less kind of little blebs. So that's not the official training yet, but once that study comes out, we might start to change to using cannula more.
Otherwise, we're good. Thank you, everyone. Take care, buddy. Good seeing you.